My name is Ann Anderson, and I'm with Serenity Health Acupuncture. I'm an acupuncturist and Chinese medical specialist. So today I'd like to talk about a simple massage therapy you can do at home called Gua Sha. What that means is that you're basically stirring things up to break up that fascia layer, to help relax muscle. It has a lot of good benefits. So what I'm doing right now is I am getting a nice lotion on my hands. Now I don't use normal lotion. I use something that I make in my office, but you can use bag balm, coconut oil, avocado oil, like the cooking oils, anything that you could eat that has that viscous quality, that really nice, oily, slick quality is what you want. So I'm spreading it on just a little bit liberally because we're going to do a lot of Gua Sha. I'm mainly going to stick with the upper back and neck today. Just do a little bit more for the neck. So you get a little pre-massage before you do it. Now, Gua Sha is performed with tools, so it's really easy. It's not very hard on your hands. Here I have one that's rose quartz, and it is a certain shape, size, but there are many sizes and shapes. I'm just choosing one of my favorites, which is this size and shape. You can also, if you happen to have a ceramic version of one of these spoons, you can use that, and I'll show you how to do that in a minute. It's very similar to what I'm going to do with this tool. So for him, I'm going to just work on his upper back, so about from here up. And we're going to release the neck, the shoulders, the upper back. So we're going to start up here, and I'll do it on this side so you can see, and I'm going to do both sides so that he doesn't come out uneven. So I'm going to start by coming down like this along the back of the neck and into that nice curve of the shoulder and along the top of the shoulder. Now, if I'm pushing too hard and getting too much force, he's going to let me know. Or if it's pulling too much on the skin, he's going to let me know. But you do want some pulling, and you do want some of that scratching. How does it feel to you?
Good.
Good. So he just said it felt great. So we're doing this. And what I'm looking for is a nice red, almost rashy look to the skin, because I want to see that I'm kind of bringing stuff up and getting it moving. So what this does is this increases blood flow. It helps, like I said, it helps warm up and break up the fascia layer, which is the layer between the skin and the muscle. It helps with the muscles, making those kind of relax. And it helps relieve pain a lot. So as you can see, we didn't get much of that, what we call Sha, the red rashy look, on his neck. But here in his shoulder, he's getting quite a bit. It's a little tricky to see from there, but. And so once I get a good rashy look, like this is getting pretty red, once I get that, I'm going to move on. And you can even do it down kind of on the side and up, as long as it's comfortable. You want to make sure you're communicating with your friend or spouse, you know, whoever's your patient.
That's a little bit much.
All right, so he just said I did it too much, so now we're going to back off just a tiny bit. So as you can see, there's this nice red rashy appearance right in here. And that's what I'm looking for. So now I'm going to come and do the other side. It doesn't take very long. It doesn't take very much, but his neck and shoulders ought to be really nice and loose and relaxed after this. So again, you come down. When you hit to the spinal area, you come out, so about midline. Now I've worked with him before, so I know what to expect from his back. But if you've never touched a person before, you will want to kind of come down and kind of feel And all you're looking for is that hardness of the spine. You want to make sure there's no zigzags or real big deviations. You want to make sure there's nothing unexpected or weird on that spine. Most of the time people will know if they have something severe like scoliosis that's affecting how it feels. This feeling okay?
Mm-hmm.
So I can go down the spine and I can go from the spine out to the side. But I do not want to go from the side to the spine. You want to go midline to outside and top to bottom. So now his back's looking pretty good. If we were doing a full treatment, I'd probably do some more. But what I want to show you next is working on arms and legs. And they're very similar. Legs, very similar setup to the arm. The shoulder would be where the hip is, the elbow where the knee is. And once you get the basic idea, you should be able to work on it on your own. So I'm going to move around. And he's helpfully moved his hand for me. So again, I'm going to take this lotion that I used, this oil. I'm going to rub it into his arm. And like I said, you can do this over the whole body. So you could do this basically from the hip and down as well. You just start at the hip and then move down the leg. So again, you're going mid, out, up, down. So you want to start with the shoulder area and work your way down the arm. And the arms might be, because he's face down, this is more that inside arm. So this might be a little more sensitive. Yeah, so you want to be a little more gentle, at least the first few times you do it. But again, we're still getting that nice red rash. Doing okay?
Mm-hmm.
We aren't quite where I want it yet, but I want to keep the video a little short for you watchers at home, so you can see a little bit of a rash. But this is kind of, so we want to come down here. And you can do this down the front of the arm too. You don't have to stick to just this spot. And you come in here, and this is taking a little bit longer. He doesn't have as much tight, like even when I'm feeling, it's not as tight and achy down here as it was in this upper back. So if you get a lot of color really fast, that's usually an area that needs to be worked on. So that is Gua Sha. I'm going to come back around. So that is Gua Sha. So again, a few details. Make sure you don't have anything, feel down their back to make sure, you can do just one good line. Feel in their neck. Make sure they don't have any lumps or moles or rashes. Anytime they have acne or rash, you want to work around that. Same with the moles. You don't want to irritate any skin stuff. So that's one area. Stay away from open sores, that kind of stuff. But again, you want to go top to bottom, midline to side. And that'll help for the whole body. You can also do it across the chest, staying away from certain tissues, of course. But in this top area where there's the muscles, you can really dig in. You can do it, and then the front of the legs, front of the arms, all of that. I'd stay away from the front of the neck. Stick with just the back of the neck. Don't do the front. Make sure that you stay away from basically mid-torso. So chest to here. Upper chest, like where these shoulders are, fine. But basically, and here to hip. And if your patient says something's uncomfortable, stop and reevaluate. It'll take some practice. You can practice on yourself. I do that all the time to keep my arms limber and while I'm working on people and to keep my own pain levels low. So that's one way you can do this to help yourself and your family. There are also other tools that you can use, and if you go to Amazon and just put in Gua Sha and kind of search around, you can figure it out. But again, all you need is the spoon. So with the spoon, very similar. I can use the handle on smaller areas like the hand or the arm, but I'm going to come here and do it along his back in an area that's not quite as red. And basically, it's like I'm scooping soup. So you're just coming in like this with the scoop, making it quick. And this actually is giving him a little bit more of a rash look than the other one did. How's it feeling?
Good.
Good. So he says it's feeling good. And now with this, I'm kind of flicking it away. Normally, I'd move to the other side because it's more comfortable for me. You want to make sure you're doing things that are comfortable for you and the patient, because if you do something that's really tweaking your arm or something, it's going to make you be less effective later and possibly give you issues. So that's how you use the spoon. Or you can find some nice tools. They usually come in rose quartz jade, or there's some nice stainless steel sets. I hope to do other videos on this topic in the future. So I hope you enjoyed this, and I will look forward to seeing you later.